you struggling to track your ovulation or to just understand your menstrual cycle? In this video, I'll be taking a deep dive into the hormonal signals that your body sends each month so that you can understand your body better. I'm going to start with breaking down the phases of the menstrual cycle, including the key hormones and their impact on fertility. I'm also going to talk about your fertility window and how you can try to calculate it. I'm also going to discuss the 9 methods that you can use to help track your ovulation, the optimal timing for testing your hormones depending on where you are in your menstrual cycle, and I'm going to be talking about so much more. Check it out. Welcome back to my channel. If you're new here, I'm Mariah, and I help women manage PCOS and insulin resistance. Through practical tips, education, and tools, I'm here to help support your journey. With over 8 years of university education, including a naturopathic medical degree from CCNM in Toronto, I've guided hundreds of women to improving their symptoms, regaining confidence, and to just feel better. Subscribe to my free newsletter by clicking the link in the description box below, or feel free to check out my website at metabolicmo.com. So on average, a typical menstrual cycle lasts about 28 days. And within that 28 days, it is divided into 2 phases. The beginning phase is the follicular phase, and the end phase is the luteal phase. And when I say a 28-day cycle, I'm referring to the average length of a full menstrual cycle, which starts on the first day of one period and ends on the first day of the next. And when I discuss day 1, that always means the first day of bleeding. Now, not every woman has that average 28-day menstrual cycle, and an average menstrual cycle can range from about 21 to 35 days. However, 28 days is the textbook average that I'm going to be using throughout this video. And it's also important to note, if a woman's menstrual cycle is shorter than 21 days or longer than 35 days, it may indicate that you have an irregular menstrual cycle. And an irregular menstrual cycle can be caused by a multitude of different factors. And this can include things like hormonal imbalances, such as thyroid disorders or having PCOS. Chronic stress can also impact the length of a menstrual cycle. If you have extremely low body weight, or if you have excessive amounts of exercise in your life, that can absolutely impact how long your menstrual cycle is. Certain medications can impact menstrual cycle length, such as birth control. So let's dive into the different phases and hormones that make up a woman's 28-day menstrual cycle. Let's start with the follicular phase, which also includes the menstrual phase. So the menses, where a woman is bleeding from anywhere from 1 to 7 days on average. So the follicular phase starts on day 1 and goes up until ovulation. And the follicular phase is the first half of the menstrual cycle. So during this phase, the pituitary gland, which is a pea-sized gland in the base of the brain below the hypothalamus, and it releases a bunch of different hormones, but the one that we're going to be focusing on is called the follicular stimulating hormone. And FSH is what stimulates the follicles in the ovaries to grow. And follicles are essentially fluid-filled sacs that contain immature eggs within the actual ovary. And these immature eggs are also referred to as oocytes. So as the follicles, or the little immature eggs, start to grow and mature, they produce estradiol or estradiol, which is also known as an estrogen. This estrogen helps to thicken the uterine lining in preparation for a potential pregnancy. And when we're talking about a 28-day cycle, the follicular phase generally lasts about 14 days, but it can absolutely vary in different individuals. So after the follicular phase is complete, we then move on to ovulation. And ovulation typically occurs mid-cycle by the release of a mature egg from the ovary, which then gets released from the ovary and into the fallopian tube. And ovulation is triggered by the surge of LH hormone, which is the luteinizing hormone. And this also comes from the pituitary gland as well. So once we see that LH surge, ovulation then typically occurs within 24 to 36 hours after seeing that surge. But the exact timing can absolutely vary in individuals. So when we talk about the fertility window, the ovulation phase is the peak of the fertility window. And the egg that has been released from the ovary and then travels into the fallopian tube, it can be fertilized by sperm for about 12 to 24 hours after ovulation. However, sperm can survive in the female reproductive tract for about 5 days. If there is sperm in the uterus or in the reproductive tract a couple days before ovulation and sperm lives for 5 days, then when ovulation occurs, the sperm then has the chance to penetrate the egg and to fertilize it. Now, even if a woman doesn't have an average 28-day cycle, there are still several methods we can use to track ovulation. And I'm going to dive into that after I discuss the last phase, which is the luteal phase. So the luteal phase lasts from post-ovulation, so right after ovulation, all the way up to that day 1 of menstruation. So after ovulation occurs, the empty follicle, which release that mature egg, then forms the corpus luteum. And the corpus luteum is what then secretes progesterone. And progesterone supports the uterine lining for implantation of the fertilized egg if it was to occur. And if pregnancy doesn't occur, then those hormone levels drop and then menstruation begins, thus restarting the cycle back to day one. So for a little recap of the hormones, FSH stimulates the follicles to grow, and it is the dominant hormone that occurs during the follicular phase. LH, which is luteinizing hormone, is the hormone that triggers ovulation, and it typically surges around day 14 of a 28-day menstrual cycle. And estradiol or estradiol is one of the estrogens that is primarily used to thicken the uterine lining, and it helps to trigger that LH surge. And then we have progesterone. Progesterone is what maintains the uterine lining post-ovulation, and it typically reaches its highest peak or its highest level about 7 days post-ovulation. So in a 28-day cycle, 7 days post-ovulation is about day 21. And I'm going to be explaining why it's important to know when those hormones peak when it comes to testing your hormones on blood work. But before I dive into that, I want to explain the 9 different methods that you can use to help track your ovulation. Now, the importance for tracking ovulation does not have to do with just getting pregnant. It's also important to know when you ovulate if you're trying to prevent pregnancy from occurring. And it's also important to know if you ovulate because there are medical conditions out there, such as PCOS, where it can make it so that you don't ovulate at all, and that's extremely important for us to know. So the 9 different methods that you can use to track ovulation include the following. You can use basal body temperature tracking, which is shortened to BBT. You can use cervical mucus monitoring. You can use saliva ferning. You can track the position of the cervix, including its firmness. You can use LH urine strips, which are also known as ovulation test strips. You can use an ovulation tracking app or just a cycle tracking app. You can get hormonal testing done, which is blood tests, urine tests, saliva tests. You can have ultrasound monitoring, and you can also base it off of physical symptoms and or mood changes. So in no particular order, let's just start with basal body temperature tracking, which is BBT. So BBT is your body's resting temperature, and it should be measured at the exact same time every day, which is generally first thing in the morning before you get up out of bed. To use BBT, you would need to track your temperature over multiple cycles, so over multiple months, so you can identify when a rise in body temperature occurs. And with this slight rise in body temperature, we're essentially looking for anywhere from 0.3 to a little more than half a degree Celsius rise in body temperature. That is higher than your baseline. And this rise in body temperature indicates that ovulation has already occurred. And this rise in body temperature occurs due to that progesterone rise during that luteal phase. And that is because progesterone has a thermogenic effect, meaning that it raises the body's resting temperature. And we typically see this rise occur 1 to 2 days after ovulation, and then it generally lasts until menstruation begins. And if you plan to track BBT, I definitely recommend purchasing a basal thermometer, which is specifically designed to measure BBT measurements because it provides more precise readings of the temperature. And always remember, there are factors that can absolutely mess up a reading during the cycle, such as illnesses, stress, lack of sleep, alcohol consumption, or travel. So always be mindful when interpreting the data. And this is also why we need to do it for multiple months before we can start seeing that trend. Now let's dive into cervical mucus monitoring. So cervical mucus monitoring is a method that you can use that is based on the cervical mucus that your cervix produces throughout your menstrual cycle. And what's interesting to note is that throughout the different phases of the menstrual cycle, your cervix produces different types of cervical mucus. So after menstruation, cervical mucus is generally dry or completely absent, and you don't generally notice it. Now, during the follicular phase, as your body approaches ovulation, the mucus begins to increase in production, and it may start to be sticky or creamy and gradually just becomes more abundant. Now, just before or actually during ovulation, the cervical mucus becomes a clear and stretchy consistency, and people often say that it resembles like an egg white consistency, and it should be quite stringy and slippery. And this generally indicates the peak fertility window. And now, after ovulation, the cervical mucus fluid again changes, and it becomes more thick, less abundant, and this is due to those progesterone levels rising. So the main things to remember about cervical mucus fluid is that fertile mucus is often clear, stretchy, slippery, and this indicates high levels of estrogen, which then signals that ovulation is very close by. And then non-fertile mucus is thick, sticky, cloudy, creamy, and often suggests that you're not in your fertile window. And now let's talk about saliva ferning. So saliva ferning is a method used to track ovulation, and that's by examining the pattern of crystallization that occurs in dried saliva. So what's extremely interesting is that as we're leading into ovulation, we talked previously that estrogen begins to rise. And that is essentially what we are examining with the saliva ferning. Essentially with saliva ferning, this is where you would collect a small sample of saliva and you would put it under a microscope, or they do have these saliva ferning test kits. And after the saliva is put under the scope and examined, you will see that fern-like patterns show up after it has dried. And that indicates the amount of estrogen that is rising before ovulation occurs. So again, the saliva ferning kits are just another way that you can try to track your ovulation. And next we are going to discuss how the position of the cervix actually changes throughout the menstrual cycle. And I'm going to discuss where it is during ovulation. So the cervix is the lower part of the uterus, and it's the opening that connects to the vaginal canal. And the cervix is also what is swabbed during the vaginal pap test to help rule out HPV. So the cervix undergoes various position changes, texture changes, and changes in firmness due to the hormonal fluctuations, particularly estrogen and progesterone. So during and after menstruation, the cervix is typically sitting at its lowest point, and it's going to be quite low, quite firm to the touch, and then that cervical mucus that I was talking about earlier is going to be quite absent, reflecting the lower estrogen levels at that point. Now, during the follicular phase, as estrogen levels start to rise and start to get ready for ovulation, the cervix then begins to soften and starts to move higher up in the vaginal canal. And that cervical mucus, as I mentioned before, will start to increase in quantity. Now, during ovulation, the cervix is actually at its highest point. It's also going to be the most soft point at this time, and the cervix itself is going to be open rather than firmly closed. And this change in the cervix position, firmness, and openness is what allows sperm to travel through the vaginal canal up into the cervix and then into the uterus. And again, the presence of cervical mucus is going to be clear and stretchy and slippery, representing an egg white consistency. And then after ovulation, the cervix begins to drop down again, and the cervix will become firmer and into a more closed position. And the cervix closes during the luteal phase to protect the uterine environment if a pregnancy was to occur. And there are different ways that you can try to find your cervix, but essentially if you were to touch the tip of your nose, that is generally what the cervix feels like. And now I'm going to talk about ovulation test strips. So LH urine strips, which are also known as ovulation test strips, are a popular method used for predicting ovulation because they're essentially measuring that LH rise that occurs right before ovulation, and it's testing it in the urine. So in the days leading up to ovulation, estrogen levels begin to rise, causing an increase in LH hormone. And that surge in LH typically occurs 24 to 48 hours before the actual ovulation occurs. And that surge is what triggers the ovary to release its egg into the fallopian tube. Now let's talk about positive results versus negative results of the LH test. So if the test line is dark or darker than the control line, that indicates that an LH surge is present and suggests that ovulation is likely to occur within the next 24 to 48 hours. Whereas a negative result is where the test line is quite light, not noticeable, or much lighter than the control line. And that indicates lower levels of LH and does not suggest that ovulation is right around the corner. And with the timing of LH strips, it's best to test with urine that is not diluted, so avoid drinking excess amounts of fluids beforehand. And if you can test at the same time each day, ideally in the afternoon or early morning, that is typically when LH levels would be the highest. And I recommend that you begin testing a few days before your suspected ovulation date. And the ideal time to start definitely depends on your cycle length, but if you have an average 28-day cycle, then you would begin testing on day 10 of your cycle. And then you would continue testing until you see that LH surge, which if you start testing on day 10, it should occur around day 14 or 15, give or take. Now, there's definitely a disclaimer that needs to be made. LH strips do not work great for women who have PCOS. And this is because women who have PCOS often have chronically elevated LH levels throughout their cycle, which means that their baseline LH might be chronically high, and it might come back with either a lot of false negatives or false positives. And it can make it very challenging to figure out if ovulation is occurring because of this chronically elevated LH. Now let's talk about hormone testing to predict ovulation. There are multiple ways you can test hormones. You can do blood tests, saliva tests, urine tests. But today I'm just going to be talking about blood tests. and the different blood tests that you can get done to assess your hormone levels. And when hormones are being tested, to understand a woman's menstrual cycle better, we typically need to test on specific days of the menstrual cycle, since we know that the hormones fluctuate dramatically during a menstrual cycle. So when we talk about the follicular phase, we generally test 3 different hormones during this phase. So LH and FSH, which is the luteinizing hormone and the follicular stimulating hormone, and estradiol, or estradiol, also known as estrogen, is typically tested early in the cycle, generally speaking around day 3. And this is used to assess ovarian reserve and function. And with LH, so although we often test it on day 3, we also test it around mid-cycle, so around that ovulation, because we are looking to see if an LH surge has occurred. So when we're trying to test LH, regarding ovulation specifically, if you have a 28-day menstrual cycle, you could consider having your LH tested on day 12 or day 13. Now, if you have a shorter cycle, such as a 24-day cycle, then you would have it tested around day 10 or day 11. And then for longer cycles, so let's say 30-day cycles, you would actually check it around day 14 to look for that LH surge. So remember, when we see that LH spike, it is usually followed by ovulation within 12 to 48 hours. Testing might be supplemented by also looking at progesterone levels about a week after ovulation to help confirm that it did occur, because progesterone, as I mentioned before, peaks about 7 days post-ovulation, which is around day 21 of a 28-day cycle. Because remember, progesterone is released by the corpus luteum, and the corpus luteum is that follicle sac that had released the egg, and that is what kind of hangs around after ovulation occurred. And now I'm going to be talking about ultrasound monitoring for ovulation. So ultrasound monitoring is one of the most accurate methods for tracking the growth and release of an egg from the ovary, and it's often reserved for fertility clinic use. And ultrasounds use sound waves to create images of both the ovary and the uterus, and essentially the ultrasound technician is looking for follicle development. And remember, follicles are those fluid-filled sacs that the egg matures in. And as the egg matures, it begins to grow in size. And a mature follicle, or the dominant follicle, generally ranges from 18 millimeters to 24 millimeters in diameter. And that is what the ultrasound technician is essentially looking for. So as that dominant follicle matures and then releases the egg, it may leave some fluid behind in the ovarian cavity. And this fluid can also be seen on ultrasound, which helps to confirm that ovulation did occur. And the ultrasound can also measure the thickness of the uterine lining. And generally speaking, when we're talking about implantation of a fertilized egg, we want to have a healthy and relatively thick uterine lining to support it. And that thicker lining generally ranges from 8 to 14 millimeters, give or take. And that is what is favorable for fertilization and implantation of that egg. And then the last thing that you can try to track your ovulation is basing it on your own physical symptoms and or mood changes. Some women may experience mild cramping on one or both sides of the lower abdomen. These cramping sensations are what is believed to be the ovary releasing the egg. And these cramping sensations are also called Mittelschmerz, and those generally occur during ovulation, but again, not every woman can feel when they ovulate. And some women may notice a heightened sex drive during ovulation, while other women may feel just more energetic, motivated, sociable, and sometimes they just feel really good during this time in their menstrual cycle. Now, the opposite can also be true, where women experience mood changes, irritability, or emotional sensitivity around ovulation. So by combining these 9 different methods for observation, you can help develop a deeper understanding of your menstrual cycle and your unique signs of ovulation. So if you found this video helpful, please hit that subscribe button so I know to make more content like this for you.